Morning, everyone. Thank you for joining our inaugural grand round for 2026. This will be a recurring event on our calendars. We, as an academic department of pathology and lab medicine with MSU, needed a platform which was convenient as well as useful for all of us to come and present and listen to other presenters as part of our academic journey. Uh, I hope this will be a day and time that will work for most of us. This would change to a noon to one slot from February onwards. Joining us today is Dr. Zarbo. Dr. Zarbo, welcome.
Thank you.
As all of us
Me.
know, Dr. Zarbo is the chair of our department and also the inaugural chair of the MSU Department of Pathology and Lab Medicine. And I'll give a quick snippet behind this presentation that you see. This was a compilation of his work over the past few months to record the history of the department and was also part of the presentation at the HFMG Jubilee, where it was very well appreciated. So, Dr. Zarbo, thank you so much for joining us today, and I yield the floor to you, sir.
Thank you, Dr. Sharma. And I appreciate being the inaugural speaker for this new event. And Dr. Sharma, Dr. Anamdar, I thank you greatly for overseeing this. It's no small task. And for those of you who follow, if you've got great talks, great experiences, please let these two gentlemen know so we can feature you as well. Especially if you're giving a talk elsewhere, it'd be nice to bring it home so we can all learn from you. So I modified this a little from what I talked about at the Jubilee, and I'm going to really kind of weave a theme through this of the vision from 110 years of history, the philosophy and how it's been synchronous, the buildings that we occupy and don't see anymore, and the people, the most important part, and then some of the accomplishments of the leaders of the department and some of the things that we will accomplish going forward. So let us begin. How did we become the Henry Ford Hospital? This was funded by the city as the Detroit General Hospital. Henry Ford was on the finance committee. He was chair of the finance committee. They collected about $500,000 and it was insufficient. They started building the buildings of the hospital and it was insufficient to continue it. And they basically went bankrupt. And Clara Ford, whose pavilion we now have offices in the nursing school from 1925, shamed her husband into taking this on as his project because he was chair of the finance committee. So this is what Henry Ford said philosophically about what he wanted to do. He had had the benefit of having had dinner with the Mayo brothers, courtesy of the doctor who would be the first physician he appointed in his hospital. So he wanted his own staff, the Henry Ford Medical Group. So why are we a closed staff model? Because this is what Henry Ford thought. It seems reasonable that a permanent staff should be responsible for the work that goes on in the hospital. After all, I don't ask every person who wants to build a car to come into my factory and build it. The Ford Motor Company is responsible for the car it makes. Why should not the hospital be responsible for the medical work that is done there? So the influence of Henry Ford Hospital, Henry Ford Medical Group, and remember this hospital is our hospital, Henry Ford Medical Group, no other physicians can come here, was based on the Mayo Clinic's 1914 model of an independent group practice with a clinic and the laboratories under one roof, which is how we became part of it. And part of the Johns Hopkins model where they have a full-time staff that united the function of the hospital chiefs with the chairs in the medical school, one and the same, which is what we're becoming now with MSU. So Henry Ford now was a closed staff, full-time doctors who were salaried with an integral outpatient department. And because inpatient and outpatient was now integrated, they could focus on preventive health. And this is what we do now, and this is how we're going to survive in the future under managed care, the clinically integrated network, value-based care. So the facts I'm going to speak to you about are from a 1979 history of Henry Ford Hospital was written by Anise Chimes. And I found this in the archives of Henry Ford Hospital, which are located at One Ford Place. I don't know where they'll go eventually, but they've got an incredible amount of material. And I've spent many days with the archivist, chief archivist, going through the pathology files. These are the things that I have gleaned from that experience I'm going to share with you. So let's talk about the buildings. I think you can recognize in the middle under the 1915 on the left, the M unit. The M unit is the original 48-bed hospital built as Detroit General Hospital that Henry Ford took over. What's underneath the red dot is a separate building, a 3-story building with an attic. That's the original laboratory building. Behind it is another building, which is a service building, the kitchens, etc. And behind it, a smokestack, which is the power plant. Behind the hospital is another building, a surgical pavilion, and a garage. So in the middle panel, you see the front of this laboratory building. And if you'll notice, there's an arcade of arches on either side of the front entrance. When you walk in the M unit, you walk through an arcade of arches. That arcade of arches was contiguous with this arcade of arches, which was a covered walkway from the hospital to the laboratory. And the picture is an early laboratory in this building from 1925. I'm going to point out some of those individuals who are in that picture who I discovered what their names were and what their functions were. So that was the original hospital in 1915. It was soon realized the hospital was too small. And they began to build a hospital in 1918 that was eventually this building here in 1921. So this is a main 4-story building. And you see it today without the outside terraces and porches. Remember, they used to put TB patients outside, breathe the fresh air. They didn't have antibiotics. What's notable is that this is a 4-story hospital. You'll recognize that today out front we have a 6-story hospital, right? So something changed in there. This small laboratory still serviced this large hospital now, this 500-bed hospital. And there's a close-up on the right of what the laboratories look like. In 1955, the 17-story clinic building was built. They started building this in 1951. It is behind the original 4-story 1921 Henry Ford Hospital. What became feasible now in 1955 is that all the laboratories now occupied the 6th floor of the clinic building, where they remain today. Again, 4-floor hospital, not 6. We go back to that original picture of the individuals, and you can see this picture in the office suite that we sit in. This is Dr. Oliver Gabler. He had an MD and a PhD. He started out with a PhD, eventually went back and got an MD. He was head of clinical chemistry in the Department of Pathology. He eventually became the head of a biochemistry section of the Edsel B. Ford Institute for Medical Research, and eventually was the director of that. Now, that Institute for Medical Research doesn't exist today, so something else replaced it, and we'll talk about that in a minute. But he had national stature and did an awful lot of work on vitamins and other chemical substances that got him renowned, such that he was awarded an outstanding contribution award by the American Association for Clinical Chemistry in 1959. Supporting him is Miss Erna Hill, a technologist in the background. So now we know who they are. 1957, we get the 6 floors of the Henry Ford Hospital. This gave us an additional 250 beds. So now we're up to about 750 beds. So now the hospital is the same height as that administrative building in the middle. And the reason why we walk down from the K building into the front of this administrative building is because the floors didn't match. Okay, so that's why that ramp is there, because an old building was melded to a new building, and the floor heights were different. And so that's the reason why you go up and down a ramp now. What I'm not showing you is the 1977 Education and Research Building. I'm not showing you that for a reason, and I'll tell you in a minute. So to go back to the layout of the 1921 hospital, this is where we live here. Behind the hospital was a path that went to the laboratory building. The laboratory building connected by an arcade as well as underground tunnels to the 1915 hospital. Behind it, supported by a surgical pavilion, and then the power plant services building, etc. It wasn't until 1925 that the nursing school was built, and you can see how much land there is behind it. You'll recognize that behind the hospital here and adjacent to this 1915 hospital is another building today, and you know what that is. That's the Education and Research Building. So the lab building went away, and they built the Education and Research Building. That was named after and so forth, right? So that became the research building and that research enterprise that Dr. Gabler oversaw for the system, just to tie back the history. So a beautiful building, and hopefully one of these days we'll get back to having our own building. It's always been my goal, and I've articulated that for many years here. I don't control the resources, but I think it makes a lot of sense. What did that building look like? They called it a 5-story building, but they were taking license. So if you count the basement as a floor, the basement had the morgue and the autopsy suite. The first floor, as you walked in, was anatomic pathology. And they also had the room of the curator of pathology. So they had a medical museum. Remember, in those days, you learned through specimens. Sometimes they became plastinated specimens. If you've been to Berlin, the museum in Berlin is just incredible. It's just the original Elephant Man is there. I don't know what we retained here, probably nothing, but this was also shared with pharmacy on the first floor. The second floor housed the clinical pathology laboratories, and the third floor had the director and research laboratories, and the top floor had animal rooms and work rooms. So animal research was part of the ethos of Henry Ford from the very beginning. Philosophically, from the very beginning, was the concept of centralization, a central laboratory, exactly what we do today. We reinvented the past. Quote, centralization produces the best results in the most economical manner. In every venture, the economy of operation is of prime importance. Beautiful theories are of no value unless they stand the test of practical application. We have experimented with laboratory methods of various kinds and have decided upon the central laboratory system. Here, all specimens are examined, all records are maintained, the autopsies are done, and the museum is being built. Well, we're doing everything except for the museum. Messengers bring specimens in from the inpatient and outpatient departments and deliver reports to the floors every hour. Back to the future. So let's talk now about the people. And we'll talk about the Hopkins connection and how we split off from Hopkins connection and other influences out of Pennsylvania. So I'm putting this underneath the buildings as they progressed and the time decades beneath it, and I'm going to talk about the people. So the first physician was Dr. Frank Sladen. His library, named after him, is on the 17th floor of our clinic building. He recruited everybody else. He was a graduate of Hopkins, Johns Hopkins. So everyone else came from Johns Hopkins. So this was the Hopkins influence. He recruited the head of surgery, Dr. Roy McClure. There's an award given to Dr. McClure's name. And 2 years in, they decided they needed their own laboratory, and they recruited a young pathologist. He wasn't a pathologist. He was a resident out of Hopkins to be the head of the laboratory service. This is Dr. Russell Hayden. So he's the first pathologist. There was no department, just the pathologist. I also show you these individuals from an early picture of that day, and Dr. Ormond was a urologist. Dr. F. Janney Smith was the head of cardiovascular, cardiopulmonary medicine, and I show you him for a reason. I'm going to call him out in a minute. The Department of Pathology wasn't founded until January of 2022, when Dr. Frank Hartman was recruited as a Hopkins graduate as the first chair. The fourth department is radiology, next pediatrics, next neurosurgery. So the hospital, although it was completed in 1918, it was fairly unfinished, and it was given to the U.S. Army as an Army hospital. And it took care of wounded soldiers without a single death in the 11 months of service as an Army hospital. And the actual construction as a functional hospital resumed in 1920, and it didn't actually become functional open until late December of 21. Remember, the first pathology department arrived in 1922, 2022. This was the 500-bed hospital with the 4 floors of private inpatient rooms and a 6-story central administrative unit that we see there today. So Dr. Hayden's tenure was interrupted. He spent a year with us. He had to go away for a year and spent another 2 years with us. In between here is the World War I, and just about everybody served in World War I. So he had 3 years of service interrupted by a year of service in the military. So the people I'm going to show you were all born in the late 1800s, and I'll let you know when we hit the 20th century. Again, MD at Hopkins, recruited 1 year out of residency by Dr. Sladen, in charge of bringing that laboratory in-house. Dr. Sladen's memo is in the archives from 1916, where he says, "I shall put him in charge of the special laboratory work which we are anxious to do ourselves instead of sending to outside laboratories." They would send it to laboratories at Henry Ford Motor Company and to Providence Hospital. Dr. Sladen goes on, "His experience and skills are above the grade of interns." This is a high recommendation. And I would recommend his appointment to rank next to Dr. Smith on the staff. Dr. Smith became the division head of cardiopulmonary medicine. So they made him laboratory director, as you can see here. So his tenure was interrupted, and he didn't spend an awful lot of time here. We don't really know what he accomplished here, but I will tell you that he became very renowned as a hematologist and a clinical pathologist after he left us. So he departed in 1921 for University of Kansas, where he became associate professor of medicine and in charge of their clinical laboratory. Remember, laboratories in those days needed to find a home, and they often put it under medicine. Didn't become actual pathology until a little bit later. He then went on to become a head of experimental medicine at Kansas, a professor of experimental medicine. He created a hemoglobinometer, which I own, by the way. So I purchased one. You can find them online, where they use the color differences to tell you how much hemoglobin you've got. And eventually he left Kansas to become the chief of medicine at Cleveland Clinic from 1930 to 1948, which is where he ended his career. So we go now to 1922 and the first chairman of pathology. This is Dr. Frank Hartman, who founded the department. He's the first chair and founder. And I describe him as the giant of pathology. And I'm going to go through his bona fides and explain why he's really the giant. So he's really responsible for creating the laboratory service, expanding the hospital services in clinical testing, and an incredible amount of work in both basic and translational research. Dr. Hartman, again, born in the 1800s from Iowa, MD in 1917 from Hopkins, and he trained with the greats and all the names in medical history. Dr. William Welch, pathology, Dr. William Halstead, surgery, Dr. Joseph Colt Bloodgood, surgery, who actually, when you read his bio, if you Google him and you bring up Wikipedia, Dr. Bloodgood was basically a surgical pathologist. He did everything with microscopic pathology control as frozen section. And he wrote books, pathology books. So Dr. Bloodgood basically was one of us. Again, Dr. Hartman spent some time in the military during World War I. And his first job as a pathologist was at Scott and White Clinic in Texas before becoming our first pathologist in chief, recruited in 1922. One of the little historical tidbits is that he was a physician who was recruited by Dr. Sladen, who was the last resident physician at Hopkins under William Osler. So you all recognize Dr. William Osler's name, the famous physician. So Dr. Hartman graduated in 1906. Osler, Dr. Sladen graduated in 1906. So you see how far back we go with that Hopkins connection. But this is where the Hopkins connection ends. Dr. Hartman was a very productive physician in organized medicine. As a matter of fact, he was the organizer. After 7 years of the ASCP's founding, he became president of the American Society of Clinical Pathologists, which later became renamed American Society for Clinical Pathology, which is what we know it as today. Since its founding as the American Board of Pathology, he was the secretary-treasurer for 17 years. He was an early president of the Michigan Pathological Society, which we now know as the Michigan Society of Pathologists. And most importantly, this was the man who was responsible for going from state to state and seeking support of pathologist leaders across the country to create what became the College of American Pathologists. So he's the first president and the founding fellow of the CAP. And this was created as a, quote, separate society of board-certified pathologists to deal with issues of hospital management, economics, and practice. It's really what it distinguishes itself as today, as you know. And this is actually the wealthiest medical society on the planet. They've got more money, our money, than the AMA. He was also an experimental pathologist, and you'll see here that he was also president of the American Society for Experimental Pathology, which we now know as ASAP, American Society of Investigative Pathology. Both Dr. Hartman and Dr. Doob, the first chair of radiology, were recognized with the AMA's Gold Medal Award for their work, animal model work, creating chronic nephritis using x-rays in dogs. And this led to the evidence linking kidney disease, renal disease to hypertension. So for that, they won the AMA's Gold Medal Award. I'm going to just talk a little bit about Dr. Hartman's personal life, not because I want to intrude on that, because another icon of pathology was in this department. So in 1955, he married Vivian Berman, Dr. Berman, PhD in physiology. She did a lot of work in pathophysiology. And this individual partnered with Dr. Hartman on many of the inventions that they did, and I'll list them on the next page. And she was a icon in her own right, a woman alumnus of the century for her graduating class of Hope College, and distinguished in pathology physiology research at Henry Ford Hospital, and has her name on a number of patents along with Dr. Hartman. Dr. Hartman probably never slept, so he retired, quote, retired in 1955 from Henry Ford after 33 years as chair. But he didn't really retire. He went on to be the medical research advisor to the Air Force, and then went on to be a medical officer in the FDA Bureau of Drugs until he finally retired at age 79 in 1970. He went on to live to age 88, and his wife, they relocated to Bethesda, Maryland, eventually passed on much later in 1987 at age 75. So that's Vivian Berman. I'm going to show you who they look like back then. So it was kind of warming for me to go through some of the early letters to realize that all chairs have to deal with the same thing, and some complaints never change. These are the 1933 memos back and forth from Dr. Hartman to Dr. Sladen, the physician-in-chief, complaining about the hemoglobin determinations. So Dr. Sladen says to Dr. Hartman, every once in a while we come to the realization we've lost faith entirely in the results of some test. I submit to you the suggestion that these tubes must be measured carefully and etched at a certain mark, 8 cc's. And Dr. Hartman responds back to Dr. Sladen, trying to defend their laboratory calculations. Obviously, there's a lot of pre-analytic variables here. And he suggests that they're going to adopt that suggestion. Your suggestion regarding the etching of the tubes has been adopted. So this goes on day after day after day in the laboratory today, as we know. So nothing has changed. So let me share with you how Dr. Hartman excelled in clinical research and innovation. So here's three of his biggies. 1943, he invented a liquid oxygen tent. They still brag about that here at Henry Ford in their publications. In 1948, he invented a photoelectric oximeter for continuous measurement of oxygen in the blood using an ear probe. And here he's with Dr. McClure, chief surgeon, Dr. Berman, who eventually became his wife, and Dr. Hartman using that on a patient, monitoring the oxygen in the blood. He also experimented with nitrogen mustard for preservation of blood and plasma, which he perfected. He created an automated blood pressure recording device with a double cuff so you can measure systolic and diastolic pressure in 1951. He experimented with plasma expanders, blood substitutes. He invented blood collection and transfusion devices. You know about the X-ray induced nephritis. And he published numerous studies, both on cancers, burns, CNS lesions induced by infection like tularemia, fevers, anoxia, peptic ulcer, viral rickettsial infections. So he was a whirlwind of a researcher as well as a pathologist. So to take you back to 1924, within 2 years as chair, the hospital staff, the entire hospital is now 100 doctors. They describe them as full-time men. I think we've come a long way. I thank the women of our team and the women of our organization. There were 5 departments at that time. We were one of 5. They held a CPC conference every Friday afternoon for all the staff. The heads of the departments had their own regular monthly meetings, and then they had an open monthly meeting with outside doctors and presenters giving professional papers, kind of like the grand rounds that we're reestablishing here. And each clinical department had its own research laboratory, and they did not contemplate establishing a separate research laboratory. And we do that to this day. Every department does its own research. The laboratory, which looked like that, now had 25 full-time workers in its separate building, connected by tunnels and covered walkways. They had an hourly schedule, a messenger service, bringing the reports back and forth. And the system was set up so that there was separation of labor to relieve professional workers, the MDs and PhDs, from as much non-professional work as possible, which was carried out by these technologists in the hospital and by other professionals throughout the hospital. It mirrors exactly what we do today. So this brings me to chair number 2, Dr. Robert Horn, whose library we sit in on a regular basis. He became chair in 1955 until 1976. So when I went through the archives, I came up with this picture, and I recognized Dr. Horn. So I brought it to the archivist, and I asked her, "Do you know who the rest of these people are?" She said, "No, I don't." I said, "Well, you have not just Dr. Horn, but over on the right, you have Dr. Hartman, and a couple over, you have Dr. Berman, who eventually became his wife." I said, "Did you know that?" She said, "No." So they went back and they have decoded everybody in that picture, so we know exactly who their names are. I haven't had a chance to search through all of them. I've searched through some of them, but very precious little is present in the internet, except for obituaries. And every once in a while, someone will say something professional about somebody. So I have certain things about certain people, like Shirley Johnson in the back. Most people, I do not, but eventually I will. I've pledged to write a book about this eventually, so maybe in my retirement I could do something like that. A unique picture, 2 chairs at the same time. Dr. Hartman overlapped a year in the first year of Dr. Horn. And for our hematopathologists on the left is probably the most famous, unless you're going to do this too. Hematopathologist produced, this is Dr. John Rebuck of skin window fame, looking at lymphocytes and leukocytic infiltrations in a skin window, and abrasion in the skin, etc. And he was a marvelous human being. I got to meet him as head of surgical pathology. He'd come to my surgical pathology unknown conferences in the 80s and 90s. And for some reason, when he passed away, his family reached out to me and asked me to do his obituary, which I did. So I had no idea that we had that close a relationship, but I was happy to do that for them. Dr. Horn. So Dr. Horn was born in the 20th century. We're progressing through time now. He's a Pennsylvania native. His graduate degree in medicine is from Yale, interned at Geisinger, and did his pathology residency in New York City at Columbia University, which was a big deal in those days. Columbia was one of the high points of pathology for many, many years, even throughout the 70s and 80s. Even though they didn't do fellowships back then, he did a surgical pathology, quote, fellowship additional training with the most famous pathologist of its time, Dr. Arthur Purdy Stout. You'll recognize that the USCAP annual meeting on Sunday has the Arthur Purdy Stout Society. Those of you who train with us are direct descendants of Arthur Purdy Stout, Dr. Horn, Henry Ford. Right? So when you walk into the Arthur Purdy Stout Society, you're basically one of them. He went on to become a professor of surgical pathology for many years at the University of Pennsylvania before he was recruited here to be chair in 1955. He also was present in organized medicine, both chairing AMA sections, chairing the board of trustees of the Michigan Cancer Foundation. He eventually became president of the College of American Pathologists as well, and he received the Distinguished Pathologist of the Year award, unfortunately posthumously, because he died suddenly at age 65, and he died here at Henry Ford Hospital. What did he accomplish? So nobody wrote down what they accomplished. So I had to go through the literature to figure out what these gentlemen did. So he authored over 100 scientific publications, most of them in cancer research and surgical pathology. He was instrumental in developing surgical pathology, not only at the University of Pennsylvania, but also at Henry Ford. And if Art Gaba is still with us online, he recruited Art Gaba. So thank you, Dr. Horn, one of our finest pathologists. And he advanced the beginning of specialty pathology at Henry Ford. Not what we have today, but the beginning of it. And he was responsible for the early institution of continuous flow chemistry analyzers that was done under Dr. Donald Remp, who was the division head of chemistry. So they had the early chemistry multi-channel rate reaction analyzers, the first multiphasic analyzers, which had little tubes with air separating samples, if you can believe the technology of the day. On his passing, we came to pathology chair number 3, Dr. Kenneth Greenwald, who served for 24 years from 1976 to 2000. Dr. Greenwald was a friend to many of us, recruited us, and his vision is what we eventually carried out. He again was born in mid-last century, and he was a Pennsylvania native. He graduated from Jefferson Medical College. He interned at Henry Ford and did a fellowship in experimental pathology back at Jefferson and to get a PhD in experimental pathology. Evidently, that wasn't to his liking, so he came back to Henry Ford and did pathology residency at Henry Ford before he as well served in the military and the U.S. Army. He served at the Brooke Army Medical Center Surgical Research Unit in the Vietnam era. His first job, kind of like the first chair, his first job was in Texas at Baptist Memorial before he was recruited back to the Henry Ford Hospital as a general staff pathologist. Somewhere along the line, he was convinced that clinical chemistry was a great career, and that was his path. So he left for a year to do a postdoctoral fellowship with Dr. John Bernard Henry. If you read the texts of clinical chemistry, he's another famous pathologist at upstate in Syracuse, New York. So he returned to be the division head of clinical chemistry, and eventually, with the illness of Dr. Horn, he was named executive vice chairman, acting chairman on his death, and eventually after the search committee was named chairman in 77. So he served till the year 2000 as chair. Dr. Greenwald did a lot. So he continually upgraded the testing technology, and he was focused on the state of the art, the fastest at the lowest cost. So we went from those early auto analyzers to the high throughput optimized modular analyzers and Siemens technology of the day back in 86. And he always emphasized turnaround time, expanding the afternoon and midnight shifts so we got to 24/7 clinical lab services. He expanded our on-site testing, recruited subspecialty diagnostics so that we could support what became the Henry Ford Centers of Excellence in transplant, neuroscience, orthopedics, cancer. Back then, all of the medical center satellites had their own independent laboratories under control of their own administrators. They were non-standardized. So we established pathology as the CLIA laboratory medical directors, supporting those laboratories after the 1992 launch of the CLIA regulations. So all this before that was totally unregulated. He initiated the first clinical lab computer system. He expanded the laboratories into the 6th floor of that Benson Ford Education and Research Building, which is why surgical pathology, histology, transcription, microbiology, special hematology, transplant, why they're all over there. Some laboratories no longer exist. Transcription and ligand assay became something else. He was responsible for establishing the use of pathologist assistants. He created the dual vice chair leadership structure. Back then it was Drs. Chrisman and Deegan, which succeeds to this day. And then he recruited the next level of leaders. So succession planning was part of his DNA as well. And he had many succession plans, and we were that succession plan. So he recruited myself, John Carey, and Mr. Waugh. And he again served as a president of Michigan Society of Pathologists. So we love Dr. Greenwald. He was a fabulous guy. He had the same dream that we do today. And he wrote about this in 1973 in a Henry Ford degree. So his view was that a blood draw station should be in the admitting office. We have K1. He said the specimens will be sent to the lab, processed, and all results available to the patient's doctor the next morning. That takes place from everywhere in the system, no matter how far away that specimen takes place. He said chemical profiles will uncover evidence of latent health problems, and the biochemical abnormalities we picked up that otherwise would not be found. And he partnered with many individuals, including Dr. Jackson, a famous endocrinologist, to find asymptomatic parathyroid disease, unknown diabetes, evidence of kidney disease, liver problems. And he said we will have the potential to improve patient care by giving the doctor more knowledge more immediately about the patient. Exactly what we do today. So that was his vision when he came on as chair, and that's what he strived to accomplish, and he did accomplish that as chair. We did everything by 6 a.m. the next morning under his leadership. On Dr. Greenwald's retirement, then it became my turn. I was vice chair for anatomical pathology, head of surgical pathology before that. I've had various titles over the years, originally senior vice president and chair, and then system chair. It's the same job. They just give me different titles. It signifies that I had opportunity to integrate everything as a vice president across the entire system. In other words, integrated laboratories, integrated delivery network laboratories. So I was born mid last century. Yes, I'm that old. I'm a Connecticut, and though I was born in New York, I was raised in Connecticut for my education at the University of Connecticut. You can see all the titles and things that I've done here at Henry Ford, including program director of the residency training program for many years. So again, I helped integrate these laboratories into one system of laboratories. We had the opportunity to bring in cytogenetics in 2013. And most recently, as you know, we had the opportunity to become the academic university department of pathology at Michigan State University. So another opportunity for us that I'll talk about. I've been showing you pictures of the chairs when they were young and when they were old. So the same goes for me. You can see that the job ages you or life ages you, but we're still plugging away, right? So it's easier for me to list the things that I have done here because I did them. and I've written them down so that it will be recorded as part of the history of the department. In bold are the things that I am most proud of having done. And I haven't done these things by myself. I have many of you to thank for accomplishing all these things, but the vision was to accomplish this. Pathology informatics. Thank you, Dr. Tuttle, for trusting me and joining me. Quality Systems Division. Hematopathology, Dr. Namdar, thank you. Molecular genomic pathology and medicine. Dr. Chidley, thank you for trusting me and coming back. Creating this research division. Adam, Dr. Chidley, thanks for bringing this forward as well. The name of this department was Pathology. I changed the Pathology and Laboratory Medicine, PALM, so that people understood that the entire enchilada was the laboratory, AP and CP, not just AP, as the talk back then was it's splitting us in half or giving it away, and we weren't going to see that happen. We created that Clinical Evaluation Technology Assessment Committee back in 2001, CTEC, a biorepository in 2001. 20 years ago, we started lean continuous improvement and innovating these business management systems that we use today. Dr. Tuttle, thank you for the first anatomic pathology barcoded histology laboratory in the world, which we use to this day. Thank you for that PACS system, which we make use of to store all these images and our synoptic reports. And in 2007, we began to expand 24/7 services so that we could become the core laboratories of the system. So Dr. Samuel, thanks for trusting me and joining me to be able to do what we offer everybody across the system, which is the fastest and the most accurate testing anywhere. 2008, we started outreach, which we continue this day and continue to expand. And in 2009 was when we started incorporating the testing of the community hospitals, and there were many more back then, including Bi-County, which doesn't exist now, consolidating them into the laboratories in a hub and spoke model. And by 2009, we'd integrated all the previously private practice pathologists into one employed group practice, which we enjoy to this day. So I have the opportunity to serve nationally as the president of USCAP, and I fully support those of you who contribute to USCAP because I think it's a fabulous society. In 2010, we embarked on paperless electronic document control. We were about 15 years ahead of everybody else, but we had to be in order to be able to operate as a system. I'm most proud of the fact that we have been ISO accredited since 2013, and I thank all of you and our quality staff for assuring that we do that, and we are a center of excellence for that to this day. I thank Dr. Sharma for the vision of creating a medical laboratory formulary, and he and Dr. Carey for carrying that out as a Tier 1 policy across the system. The Center for Precision Diagnostics. There are so many of you who helped us build that over a decade ago. Dr. Chidley, Martha, Adam for continuing to support that. Dr. Kiss, Dr. Shaw. Without you, that wouldn't exist. So the vision is one thing, but it's the people and the implementation and execution, which is another. So that Center for Precision Diagnostics is second to none and something to be bragged about, frankly. We didn't have total lab automation where the line does everything, moves the specimen to the instrument until 2016, and there's so many of you who did that, and it was basically a labor of love over a period of years before that became a reality. And now it's time to refresh that. So many of you will get to touch that new vision of what does a refreshed automated lab line look like. And Dr. Chidley and Dr. Gupta, thank you for initiating and overseeing the most incredible subspecialty surgical pathology practice I've ever been associated with. And the fact that you can even do that schedule is amazing. In my day, it was 8 hours to do a schedule. I can't imagine what it takes to do. I know you have QGenda, but I know it takes an awful lot of work. And thank you, Dr. Kalaman, for trusting me and joining us so that we could bring Henry Ford Jackson allegiance into the system and joining us in our professional practice. And Linoge and Dr. Tibbetts and Kathy and many others, thank you for putting us in the record books as the first laboratory to do COVID testing in the state of Michigan in 2020, March 16th. So those are some of the things we've accomplished in the last 25 years. So in my closing 15 minutes, let me just share some future vision with you. This was what we created over time. We created the most incredible hub and spoke core laboratory for the system. And I'm showing you what we call legacy Henry Ford Health, which is Henry Ford. And we do this and we do this real well. And the icons show you one core laboratory with community hospitals with emergency rooms, 10 emergency rooms that we serve, as well as medical center laboratories. And I thank Dr. Sharma, Raj Bhatti, and many others for making sure that that thing works. Most recently, within another week or so, we will be bringing on our new colleagues from Michigan State University. We will be bringing their testing from the East Lansing campus, dominantly about 70–80% of that to Jackson, where we've built out new laboratories. So what I'm showing you in blue with a yellow core are the new model of support of the core laboratory with mini hubs. So we have small mini hubs with automated technology where we can do things more rapidly. So you are the mini hubs that are going to be the central core as we expand our footprint and expand our footprint with new customers in your regions. So it'll be both outreach and other individuals joining the practice. So all the physicians of Michigan State University are now part of the Henry Ford Medical Group, and another 1,000 physicians of the Ascension Medical Group are part of the Henry Ford Medical Group, a different partner category. So a lot of their work will be coming to us, and what we'll be trying to do is doing it most efficiently, closest to the point of draw, so that it can make it faster. So we're basically cloning ourselves across the system, which is a brilliant strategy. And I thank Adam for that. He calls this the dandelion model. It's expanded hubs, mini hubs, and an expanded delivery model, which we will rely on going forward. What I'm showing you is the number of hospitals that are branded as Henry Ford Health. In that joint venture, we are the 80% partner, so it's Henry Ford. They're all labeled us. They don't all operate like us. We're striving to integrate them both laboratory-wise as well as clinical enterprise-wise. Our clinical colleagues are trying to create horizontally standardized service lines. Oncology is one of them, for instance. The split is an artificial split where administrators take the east versus west region. You can see geographically where they're located. So we span 72 miles north to south and almost 130 miles east to west out to the river, the St. Clair River. You can see a small little hospital out there. The ones in blue are Henry Ford Pathology, and thank Dr. Bramwell and Dr. Akanksha Gupta 2 for joining us as a professional staff at Henry Ford Genesis up there in Grand Blanc. So we will see this map change over time as we begin this integration, and we'll have more to say about that as we implement Wave 2. Right now we have Wave 1, all the outpatient is integrated into our Epic and our SunQuest Clinisys EMR and lab information system. At Wave 2, the hospitals and the subspecialists in June will come on board. And we'll see what that looks like. We're working towards that integration now. This is what the future of Henry Ford on the main campus is going to look like. That's your new 2029 Henry Ford South. And that is a glass tower, and you can see about half of it in the infrastructure, the metal infrastructure going up. It's got a pedestal with ER, imaging, etc. There's a building behind where we have laboratories that will support that structure specifically. Most of Detroit that we live in is from the early 1900s. You can see the GM building, the Fisher building, the Henry Ford Hospital. You can see what it's going to look like. This is the artist rendition of what they're going to call Henry Square. It's going to be a green space. That's going to be the largest green space in the city, evidently. And you'll see that the Henry Ford buildings from the 2020s will be ringing it. I believe there will be an educational focus in the North Campus, but half of the hospital beds will be on our North Campus, and our laboratories will remain there. Our dominant laboratories will remain there. There is room for another building on the south face for another glass tower like this. So that's in the 2030s sometime as they need it. They will put up a second tower. And Adam and I have been asking for a laboratory building to support these two towers. And that is our vision of the future, and the conversation we have with the planners and the architects is, where's that new laboratory building? So we've come a long way from this grand vision. It has the same philosophy of patients first, our people, and a centralized, structured approach to medicine with an employed group practice. We're innovating different models of that to respect pluralism and to allow private practitioners to evolve with us. But it'll be on a very highly standardized approach to medicine. So if we look at our continuous evolution and the technology of its day, from Doctors Hayden, Hartman, Horn, Greenwald, myself, into the future, which is molecular genetics, which we knew and banked on over a decade ago, which is why we are where we are. If we hadn't started that investment a decade ago, we'd be outsourcing our molecular genetics as well. It's basically unaffordable if you try to start today. So part of that vision is to see far enough down the road. Like the fighter pilots, you have to be able to see the bogey in the sky before they see you. And fortunately, we've had great vision and great execution on that vision. I thank you all for getting us to this point in time. What's next? So this is our MSU academic vision. What I'm showing you is what the departments of the medical school look like. So we have our own divisions of Henry Ford Pathology Lab Medicine. Under our bylaws in the medical school, we're allowed to create certain committees and structures under a medical school department. The names in blue are those that we have either nominated or succeeded in getting you a non-prefix appointment. In other words, you are a bona fide assistant professor, associate professor, full professor. Those of you in green are either seeking or have been given the clinical appointments, the prefix appointments, according to MSU. So you're clinical professor, clinical assistant professor. The path from prefix to non-prefix is one we'll talk about in future staff meetings. It is one where you have to commit yourself to an academic path of promotion. You have to show evidence of activities towards that path. That's not for everybody, which is why we have the clinical pathway. Why would you want a non-clinical prefix appointment, other than the fact that you can drop the clinical from your title? It's because you have the ability to serve on a committee of the medical school and to have voting rights. So you can attend, but you can't vote unless you're a non-prefix appointee. And then there are committees of the medical school itself. There's other academic advancement where we can serve on other committees within the medical school. So those of you who have academic aspirations, this is the path to that academic aspiration. So I'm here to help you and assist you in that accomplishment as part of your professional development. We will have many professional development lectures that are given to us that we will share with you going forward, as they are valuable to those of you who want promotion and those of you who want to go from green to blue. And if I don't have your name correctly identified or your status correctly identified because I didn't receive your letter, which is quite possible, I've got many cooks in that kitchen, please send me an email so I can correct that, correct my records, and correct this record as well. So I look forward to this path. I know it's another job, but I asked for it. I asked the previous dean, wouldn't he want to be a world-class medical school? And no world-class medical school operates without a world-class laboratory. So we are a world-class laboratory, and now we're going to be the academic laboratory pathology lab medicine support of this new medical school for us. So I look forward to working with each of you in this going forward. And I think it's another exciting chapter for Henry Ford. And I will call out the fact that we have new fellowship in molecular genetic pathology that we're recruiting for under Dr. Gomez's leadership. We still have fellowships in laboratory genetics and genomics and pathology informatics, Dr. Shaw and Dr. Tuthill. So that is my closer, coming back to a summary of our common philosophy and methodology. From the very beginning, this organization has had a continuous improvement thought process and in problem solving as well. We do it in a very defined fashion that we call lean. If I go back to Henry Ford and I read his biography in 1928, he said this, which can be said about us as well. He said, our own attitude is that we are charged with discovering the best way of doing everything, and that we must regard every process employed in manufacturing as purely experimental. If we reach a stage in production which seems remarkable as compared to what has gone before, then it's just a stage of production and nothing more. So this is doing the work and improving the work so that tomorrow is a better day not just for us, those of us who toil in this factory, but the patients and the clinicians who benefit from the improvements that we make on a daily basis and that we can record on an annual basis as part of our annual report. So I thank all of you for supporting me, supporting this department, supporting your leaders as we try and strive on a daily basis to do the best we can to be better every day. This is us from last year. We actually write down the names now, which is better than what I came across in the archives. So we know who you all are, and we'll continue to do that. Unfortunately, this is a record of my aging over the last 38 years. So every year I get older and older, but that's life, right? The alternative is not as pleasant. If I go into the archives, I find a lot of people who are icons in their own right that I trained with and I worked with here and I've known over the years. And do you people know any of them with the question mark? Call it out if you know who they are. Do you know who the question marks are?
I recognize Dr. Ma.
Yeah,
Dr. Ma.
And Dr. Lee.
Yeah.
Dr. Lee in the back.
Dr. Kankovic. Yeah, and then Nelson Main on the left.
Nelson Main, young Nelson.
And then I think this was Dr. on the left upper. This was blood bank. I'm blanking on the name. Blood bank director.
Dr. Sheikh Saeed, who was the division head of hematology.
Hematology.
Famous hematologist. And on his passing away, I think Dr. Namdar even served us in the blood bank for the first couple of years. He was a blood bank for the first couple of years. On the lower right is Dr. Dan Van Dyke, who was the head of cytogenetics at that time. He was a very huge benefactor of ours. He would donate to this department. He went on to direct cytogenetics at Mayo Clinic. And the upper left is a young Dr. Azordes Morales, who trained here and was on staff here, famous surgical pathologist, cardiac pathologist, and he left to become chair at the University of Miami, where he retired as chair in the 70s as well. And he became a friend to me. He innovated that express processor that we use, that we load every 20 minutes. That was his invention, which he basically licensed to Sakura. And I was involved in the early validation studies of that instrument that he created with his own people there at the University of Miami. So he became a mentor and a friend to me as well. So these are your historic beings, and hopefully each one of you will be historic beings as well. And I didn't mention Dr. Robert Osamura, chair of many medical schools in Japan. He comes to USCAP every year. I've been president of the International Academy of Pathology, and hopefully I can introduce you to him at this year's USCAP meeting. He'll be there. I'll be there as well. And I look forward to seeing many of you there in San Antonio at USCAP. So I thank you all very much for your attention this morning. It's been my pleasure to give this talk as a record of Henry Ford Pathology. And if you have any questions, since we're at the end of the hour, come and see me, or you can sit down with an espresso and talk about anything you like. But I thank you very much, and it is my privilege to serve as your chair. Have a great day, everybody.